The fetal echocardiography is really a specialized procedure that is performed only where there's a clear indication. And so indications such as a previous child with congenital heart disease, or where something is seen abnormal on a screening ultrasound, such as two sides of the heart where one is bigger and one is smaller, or one could have another congenital anomaly that's not in the heart, and then we know that there's a higher chance of a congenital heart defect being present. So we tried to take this to a step further in something we call the cardiovascular profile score, which we developed about 15 years ago. And doing that score allows us to tell whether or not heart failure is present in a baby who we already know has a congenital heart defect, or in a baby who has growth problems, for example, whether congestive heart failure is actually part of the picture. And that will help us to predict what's going to happen in the future, and whether or not delivery might be needed, or whether even treatment might be indicated, where we give the mother medicine that then goes through her circulation into the uterus and into the fetus, and can treat some of these conditions. The fetal echocardiography is really the use of ultrasound to make images of the fetal heart through the amniotic fluid, through the uterus, through the chest wall, and then actually be looking at a very small structure distant from the transducer. So the ultrasound technology has progressively improved. And this progressive technology improvement is what really allows us now to be almost examining, just like examining the patient, but instead of feeling their chest or feeling their liver, you're actually examining it by looking at it with ultrasound. You're now listening with the Doppler tools, which allow us to measure the blood velocity in the various vessels and in the chambers of the heart. And we're starting to see with color Doppler, where we can see where the flow is going and what the nature of the flow is with color Doppler. We can do what's called a 3D or a 4D reconstruction of a flow or of a structure. And so we're seeing the opportunity to really make quite a confident diagnosis of fetal cardiac abnormalities as early as 18, 20 weeks gestation, along with an assessment of the physiology about whether the mother's placenta, mother's uterus, the placenta, whether the baby circulation is functioning normally. If you think about it, really the whole era of having the fetus be a patient is something relatively new. Certainly in the last decade here in Florida, I think people have come to understand that the fetus could be thought of as a patient who could be treated. We can give the mother medicine, and we call it transplacental therapy, where the mother's medicine is given, the mother's given medicine, and she's like the intensive care unit, and taking care of the baby, the medicine goes to the baby and converts the tachycardia. Fetal echocardiography is done with the fetal cardiologist there and present at the time. So the sonographer may be helping in collecting the information, but the fetal echocardiogram and the perinatal cardiology consultation would be done at the same time. So we'll sit down, do additional imaging if necessary, those of us who actually scan along with the sonographer, and then sit down right at that time to share with them what our findings are. In the days following surgery, we'll use echocardiography to establish that everything is all right, that the heart is now pumping normally again, and that everything is open. It's supposed to be open, and closed. It's supposed to be closed.